Hello students, let's study actinomycetes. So introduction, traditionally considered to be transitional forms between bacteria and fungi. Like fungi, they have mycelial network of branching filaments. They are true bacteria bearing a superficial resemblance to fungi. The actinomyces species are present as normal flora in mouth, intestine and vagina. Classification, medically important actinomycetes, anaerobic are actinomyces, pathogenic species, Actinomyces israeli, most common causative agent, Actinomyces nuslandi and A. odontolyticum. Aerobic nocardia, asteroids, brasiliensis and KV. Morphology of actinomyces, gram-positive bacilli, non-motile, non-sporing, present in mycelial network. First, granules crushed between two slides, gram-stained sunray appearance, central gram-positive filaments, peripheral swollen radiating club-shaped structures is called as sunray appearance. Culture characteristics, thioglycate liquid media, fluffy balls at bottom of the tube is shown by Actinomyces israeli. General turbidity, Actinomyces bovis. Sticking on brain heart infusion agar, molar tooth colonies incubated anaerobically at 37 degrees Celsius. Pathogenicity of actinomyces causes actinomycosis. Pathogenicity, actinomycosis. Mode of ingestion, infection, endogenous. Result from trauma or dental extraction. Predisposing factors to favor the tissue invasion, trauma, foreign body, poor oral hygiene. Pathogenesis grow in oral anaerobic environment, induce mixed inflammatory response, painless indurated swelling with sinuses, drain pus containing granules. Spread to neighboring organs include bones, tissue destruction. Chronic suppurative and granulomatous infection, multiple discharging sinuses contains granules. Then they cause fibrosis and tissue destruction, characterized by development of indurated swellings, mainly of the connective tissue, suppression, discharge of sulfur granules. Lesion points toward the skin, multiple discharging sinuses. Clinical manifestation. The clinical forms are cervicofacial actinomycosis, common form, painless, low-growing hard mass with cutaneous fistula, also called as lumpy jaw, dental caries, and periodontal diseases. Thoracic form, pleural effusion. Abdominal form, due to spillage of intestinal flora secondary to bowel surgery or appendicitis. Pelvic form, following intrauterine contraceptive devices. Brain abscess, disseminated form, hematogenous spread, lungs, liver forms the nodules. Other lesions, inflammatory disease of gums, gingivitis, periodontitis, root surface caries, mycetoma. Laboratory diagnosis, first sample collection, pus form from discharging sinuses, demonstration of sulfur granules. Pus taken in the test tube with saline, then shake and on standing the granules sediment and withdrawn with capillary pipette. Granules also obtained by applying gauze pads over the discharging sinuses. Microscopic examination of sulfur granules. Sulfur granules crushed between slides and stained by gram stain and examined. So macroscopic color of granules white to yellow. Size minute specks about 5 millimeter. Microscopic gram stain sunray appearance. Central gram positive filaments purple and peripheral swollen radiating club shaped structures pink color. Culture, the thioglycolate liquid media is used, incubated anaerobically at 37 degrees Celsius. So it shows fluffy balls at bottom of tube in Actinomyces israeli and general turbidity in Actinomyces bovis. Streaking on brain heart infusion agar, molar tooth colonies can be seen. Hello students, let's study nocardia. So introduction, resemble actinomyces morphologically, but they are aerobic, acid-fast, frequently found in soil. Infection is exogenous. Species are N. asteroids, brasiliensis, and KV. Pathogenicity, it causes nocardiosis. So there are three types of infections: cutaneous, subcutaneous, and systemic. So in cutaneous infection, there is local abscess, cellulitis, lymphocutaneous lesions. Subcutaneous nodules, and mycetoma. Systemic, pulmonary disease, pneumonia, lung abscess, metastatic manifestations, brain, kidney, other organs involved, and more common in the immunodeficient individuals. Laboratory diagnosis, specimen, pus, sputum, microscopy, gram stain, gram-positive filaments in mycelial network, and Zn stain using 1% sulfuric acid. They are seen as acid-fast filaments. Isolation, culture, ordinary media, and LG media. Colonies dry, granular, wrinkled. Color of the colonies yellow-red. Differences between actinomyces and nocardia. So actinomyces oxygen requirement anaerobic, nocardia obligate aerobic. Habitat actinomyces found as oral flora, infections occur endogenously. Nocardia usually habitat is soil, infections occur exogenously. Risk factors in actinomyces, disease occurs in immunocompetent host, nocardia in low immunity. Acid fast actinomyces non-acid fast, nocardia acid fast with 1% sulfuric acid. Culture actinomyces spidery molar tooth colony in solid media, fluffy ball at the bottom of the liquid medium, that is thioglycolate medium. In nocardia, colonies are creamy, wrinkled, and orange to pink. Drug of choice in actinomyces penicillium, nocardia, sulfonamide, and clotrimazole.
Hope you find this session useful for your understanding and for your exams. Thank you.